Hi, I'm Camilla, and I'm here today with Genevieve and Alejandro Quevedo, and we're actually outside a dentist's office this morning. And what are you here for today, Alejandro?
Today I'm here for the continuation of my Mercury fillings extracted and replaced with Kevlar and porcelain, state-of-the-art dentistry, and I will probably get the second region of my mouth done. I had the first bottom half, which was about 4 fillings, and I have about another 4 on the second half today.
And why are you getting that Mercury fillings out?
Well, Mercury has been really like old kind of technology that dentists have been neglecting to kind of change and update. It seems like in other parts of the world, like they've already been really progressive, and here it's still they're still doing amalgams everywhere you go and putting the mercury in your mouth. I got mine in when I was about maybe 14. My parents didn't know much about going to the dentist. They just took me down to the local guy who pretty much just laid bars on all my teeth and cleaned them out. So I just have like a railroad bar through each one of my sections. They've been there about 25 years. I got them done when I was like about 10, 11, and they're starting to decay and they're starting to crack because that's the way mercury is, the metal. So with the hot and cold, it doesn't expand and contract like other materials that are now being used. So it cracks the teeth and it produces pockets where mold and bacteria could build on the bottom. Like any metal, if you put a piece of metal on your body, you start seeing the green worm. That's the same thing that happens to the mouth over time. And I've noticed that as the first one he took out, I saw all the infection and saw all the like bacteria, the mold and the growth under there. And then I saw what he had to do to clean it out. I also did see the 2 fractures of how when the mercury expands and closes down, my 2 teeth are kind of, each one of my teeth is fractured in the middle from that experience. So the first one has been done, my right side of the mouth, and the next one's gonna be done today.
Wow.
Yeah.
Wow, so you must be relieved that this is happening.
I am really relieved. I first heard about this probably about 10 to 15 years ago, so I was looking forward to taking it out because Alzheimer's, you know, all these heavy metal diseases to the brain. And I finally got to the experience of starting to receive a lot of pain and starting to really feel 1 or 2 of them go bad. As soon as I did, I pretty much went to the dentist and they tried to just really fix it, and I started experiencing the problem again. That's when I sought out systematic dentistry, and I really had other options to fix it permanently instead of just patching it up, drilling and filling. So.
Right. Now, my understanding is that if you drill mercury fillings, you can, at a high temperature, release mercury vapor, which is incredibly toxic to breathe for the patient. So what was your experience with that?
Well, yeah, I have seen a few documentaries on the subject, and mercury vapor is probably... Did
you have that?
Yeah, well, no, I mean, I have mercury in my mouth, but when they extract it, the mercury vapor, if they don't do it properly and really put you in kind of a gas mask and set some ozone up to eliminate all the bacteria entering through your mouth, even the doctor's wearing a gas mask to prevent him from breathing in that vapor. Sometimes if you don't understand what you're doing, it can be more dangerous to take them out, and which I've heard, especially here in the States, because they're so... Right.
So you were actually wearing an oxygen nasal mask?
Oxygen nasal mask, yeah. And there was kind of a vent of ozone being shot up through me. I was oxygen in my nose, and so I wasn't breathing any of it. And the doctor had a mask on too, so it's pretty much eliminated from the environment with a vacuum too.
Right. Genevieve, you're here for another reason. What is going on with you?
I have a chronic infection. About 2 years ago, I thought I'd budget my dentistry, and I went to his aunt's dentist, and they took my my wisdom tooth out. It was a horrible, horrible experience. I remember flashbacking to when I went to Dr. Pana and he took out my top wisdom tooth and how quick and easy and painless it was, and what the heck was going on now. But it was $200 less, and I thought it was a deal.
What happened?
I find out when I go back to Dr. Panah, because it's such an awful experience, I'm like, I should never have done that. Shame on me. I go to Dr. Panah for teeth cleaning, and he's all like, well, you know what? Let me see this. There's a bump. There's something going on. Let me take an X-ray, and there it is, a huge cesspool of bacteria, and it was the cause of my chronic infection. And now, reevaluating these past 2 years, I've been sick. I've had halitosis, can't get my breath fresh, I'm brushing my teeth, I'm flossing, I'm noticing my skin is irritated, and I eat well. And so Dr. Panah, he's all...
Were you tired?
I was very tired, irritable. And Dr. Panah is all, shame on you. You know, if you're going to cheat on me with someone that knows what they're doing. I'm like, so sorry. But that's what I'll be getting done. We'll be opening up the area again and cleaning it out, excavating it out, and doing the job right.
So basically, you've had a chronic infection for the last 2 years from some dentistry that you had in the past with another dentist. Wow. So let me ask you, how did you choose Dr. Panah, who's known for systemic dentistry? How did you choose, and why did you choose systemic dentistry?
Well, once I started realizing that I wanted to get the mercuries out because I had like 26 in my mouth and they started to go bad.
Wait, 26?
Yeah, 26, yeah.
Wow.
Yeah. And so I have like 7 or 8 on each side. Yeah. So I realized that I needed to do something. I'm kind of a health nut myself, and I eat really healthy. I work out. I've been a personal trainer for years. And I had to do a lot of research to try to find out what was going on, because there was a lot of, especially here in the States with modern dentistry, they say just leave them in, like it's worse to take it out. You'll probably get more of the bacteria and the vapors taken out. And I didn't really want to accept that, knowing that, you know, like in other parts of the world, they've been a lot more progressive. So I ended up hearing a program a while ago on KPFK where I first got privy to Dr. Panah, and I sought him out, and I really saw there wasn't too much in comparison around, you know. So through the research and a little bit more online, I really found out that like he's following more of a, I guess, a worldly, progressive kind of advanced state of dentistry, and it's pretty much not available too much in the States. So
sounds like it should be.
Should be.
Yeah.
So Genevieve, what is your understanding of systemic dentistry when you made that choice? What is systemic dentistry to you?
It's the whole body. It's looking at the mouth as a part of your body. It's all connective. It's not, the mouth is not outside of the body, and in order to maintain holistic health, you have to treat the whole body, and it starts from the mouth. You can't dismiss the mouth. It all starts from here. Our character, what we put in our mouth, it's all here in the mouth. Knowing that my teeth are connected to my organs, knowing that it all starts in the mouth and that bacteria can travel through my blood system, and I'll go to the doctor and I'll say I have a problem, and he's going to treat that specific little problem when it all really started in my mouth. And so he's the to-go guy. He's number one to me. I love Dr. Panah. I heard him on KPFK, and everything that he said to me resonated with me. I battled with my doctors. My dentists made me cry. They made me feel dumb. They made me feel stupid. My teacher always said there was no dumb question, and they made me feel dumb, basically. And Dr. Panah, he's educated. He furthers his education. He never stops. He does not stop learning.
Let me ask you one more question. And how do you feel about the American Dental Association choosing at this point not to follow the guidelines of systemic dentistry?
Well, I don't have anything nice to say about the American Dental Association. They're kind of a bunch of thugs that eliminate any kind of competition and pretty much have a lot invested in the technology and the type of services they already are providing. So they really don't have any interest in changing, and it's kind of like...
I'm assuming there you're talking about a vested interest.
A vested interest in Mercury, and also the machines that they already have, in the old technology for the x-rays. They have like just insane old...
I mean, my understanding is that the American Dental Association is actually a trade organization that owns the patent on mercury amalgam fillings. Is that your understanding?
Yes.
Yes.
It's criminal. It's basically criminal what's going on. They're not, again, it's all about business and it's not about the person. And Dr. Panah is all about the person. I am I was a single mother. We're married now. I'm going to school. I'm going to nursing school. We don't have a lot of money, and we're making it happen. He's making it happen for us. We're able to put this priority and make it happen.
Yeah.
Okay, so one final question. How important is your health to you?
It's everything to me, yeah. I pretty much every day take it into conscious of everything I eat, up to the energy around me and my environment, and try to keep the most healthy, clean environment. So it's my top priority, yeah.
It's top priority. Genevieve, how about you?
Again, as a wife, as a mother, as a daughter, as a soon-to-be nurse, I got to keep my wits about me. And how am I supposed to keep my wits about me if I'm not healthy? How am I supposed to be able to have patience and understanding and continue my career if I'm not sane in here? And it's a whole body-mind system. It goes hand in hand.
Okay.
Thank you all so much.
Thank you.
That's Genevieve and Alejandro with us today outside Dr. Panahpour's office here in Santa Monica to receive systemic dentistry.